to the webinar on PACE evaluation findings on early effects of 9 career pathway programs. Thank you so much for joining. I am Karen Gardner. I am the PACE project director. And just to give you a sense of what we will be covering, here is an overview of the webinar. We'll begin with an overview of the Pathways for Advancing Careers in Education, also known as PACE, evaluation. The webinar will then summarize the findings for the 9 studies that comprise PACE. And for 8 of these programs, we'll describe how they affected educational attainment after 18 to 24 months. And for 1, we'll describe how it affected earnings. We'll then hear from representatives from 3 of the programs that participated in the study. Specifically, we'll hear about their approaches to implementing a career pathway strategy and also what they learned being in the study. And as Yvonne noted, we will leave time for questions and answers at the end of the presentation, so be sure to keep a running list as we go. Okay, so today's roster of presenters, we will begin with Nicole Constance, who is a senior social science research analyst at the Office of Planning, Research and Evaluation, the Administration for Children and Families, which is part of the U.S. Department of Health and Human Services. She is the project officer who has overseen the PACE study. And next, I will present the cross-program implementation and impact findings, and then we will hear from 3 partners. First is Brian Stewart. He is the Dean of Education and Biomedical Sciences at Pima Community College, which is in Tucson, Arizona. He will discuss the Pathways to Healthcare program. And then we'll hear from Sienna Rifkin. She is a project manager at the Workforce Development Council of Seattle-King County in Washington State, and she will discuss Health Careers for All. And then finally, Yvonne Lau, who is the Dean of Academic Affairs and Career Pathways, and Ian Sharping, who is the Director of Educational Effectiveness, Instruction, and Curriculum, will discuss the Carreras en Salud program at Instituto del Progreso Latino. Okay, so now I will turn the webinar over to Nicole Constance.
Thank you, Karen, for that wonderful introduction, and thank you to everyone on the line for joining us today to hear about the findings of our evaluation. For those of you not familiar with my agency, the Administration for Children and Families, or ACF, is a division of the U.S. Department of Health and Human Services. Our mission is to promote the economic and social well-being of families, children, individuals, and communities so that they are resilient, safe, healthy, and economically secure. Within ACF, my office, the Office of Planning, Research, and Evaluation, or OPRE, is responsible for advising the Assistant Secretary for Children and Families on increasing the effectiveness and efficiency of programs to improve the economic and social well-being of children and families. With that mission in mind, we started this project back in 2007 with the goal of identifying the next step in interventions to promote employment and self-sufficiency among low-income families. The goal was to be innovative and ahead of the curve and to find a framework for programs that would help move families out of poverty once and for all. After a lot of consideration, we settled on career pathways as the framework that we should study. A central component of career pathways programs are that they provide post-secondary education and training organized as a series of manageable steps leading to successively higher credentials. There should also be a strong connection to the needs of the local labor market. In addition, career pathways programs include assessments of students' skills and needs, promising approaches to basic skills instruction and occupational training, and academic and non-academic support services to promote student success. After deciding on career pathways programs as the framework that we should study, we looked across the country at programs that embodied the framework. We found the 3 programs featured today and 6 others who each included important elements of the framework. Each of the 9 programs brought something unique to the table, and across the 9 versions of a career pathways program, we've learned a lot about them. I'll let Karen share the specifics of our findings, but I want to emphasize that the findings are exciting and show the true promise of this framework for promoting occupational training among low-income adult learners. We are so very excited to share our findings and hope you find the information shared today helpful for your own efforts. I also want to say that throughout the evaluation, the staff at each of the 9 programs have been phenomenal partners, and we are so grateful for their partnership. My office and other federal research offices have invested heavily in studying career pathways programs. PACE was only the beginning of what has grown to be a robust research portfolio. In 2010, Congress authorized the Health Profession Opportunity Grants, or HPOG program. HPOG programs across the country use a career pathways framework to provide education and training in healthcare occupations for low-income individuals. My office is overseeing rigorous evaluations of the first and now second round of grants. In addition, we've invested in longer-term follow-up of the programs in our PACE study so that we can see how the programs affected students' lives 3 and 6 years down the road. And that's just the work that my office is overseeing. Research offices in other federal departments, such as the Department of Labor and the Department of Education, are also overseeing research on career pathways programs. This is a topic with a lot of interest and a lot of promise to transform the way we think about training people who need good jobs to support their families and to meet the demands of local labor markets. This is a very exciting time for research on career pathways programs. My office is in the midst of releasing a lot of findings reports in a relatively short span of time. It's been a long wait to get to this point, and now it seems like it's happening all at once. The findings themselves are often exciting for the programs in our studies and for their local communities who support and believe in them. But I can tell you that my counterparts in other federal agencies are also excited about this area of work. I've given several presentations to my federal colleagues about what we're learning in PACE. We still have a lot to learn, and I look forward to continuing to share what we're learning with my federal colleagues and other community stakeholders like you. Before I hand things back to Karen, I want to close by extending our gratitude to the many people who made this effort possible. First, to the evaluation team at Apt Associates for the excellent work they've done on PACE. It took a lot of organization and effort from a lot of people to conduct 9 evaluations simultaneously. This project is complex with a lot of moving pieces, and there are many things to keep track of, and you all have done an excellent job getting us to this point. I also want to, of course, thank the staff at each of the 9 programs for agreeing to be in this important study. We know that being in an evaluation is scary, and it's hard to tell people they've been assigned to the control group. We ask you to operate your program under the observation of the study team, to boost your recruitment to meet study enrollment goals, participate in data collection activities, and for so much more. Everyone handled our many requests with grace and cooperation, and as I said earlier, have been phenomenal partners in this adventure. We're looking forward to continuing this relationship as we work on the longer-term follow-up studies. Finally, I also want to take a moment to thank everyone who's joined our webinar today. Without interested stakeholders like you, what we've learned and will continue to learn from the study would be for naught. We appreciate your support. And so without further ado, I'd like to hand things back over to Karen so she can share with everyone what we've learned.
All right, thanks, Nicole. So I will give a quick overview of the study, and then I'll summarize the implementation and early impact findings for the 9 programs in PACE. This will be a very quick summary of the programs, and it is based on a paper that is in process, which we will hopefully release this fall. So starting with what is PACE, for those of you who are not familiar with the study, it comprises 9 separate evaluations of promising programs within a career pathway framework. As you know, there are different definitions of career pathways. And for PACE, we recruited programs that organize post-secondary education and training as a series of manageable steps, each one leading to a higher credential and a higher paying job, in order to engage participants, many of whom are non-traditional college-age students. And to help them persist, the program includes key components. Nicole mentioned these. It includes academic assessment to place somebody on the right step of the career ladder, and non-academic assessment to identify barriers that can interfere with program success. Innovative basic skills in occupational training instruction, such as active learning techniques and contextualization, academic and non-academic supports to help students persist and complete, and connections to employment in the program or post-program. So the study was led by Apt Associates, and as Nicole mentioned, there were lots of moving parts, and we couldn't have done it without a number of our partners, including MEF Associates and the Urban Institute. And thank you to ACF for funding and sponsoring the study. We received additional funding from foundations, and 3 of the programs in the study including 2 that you'll be hearing from today, were funded by the ACF Health Profession Opportunity Grants that Nicole mentioned shortly ago. Okay, so with that overview, we have 9 programs in PACE that comprise 18 different sites, and as you can see, they are located across the entire country. Having a little trouble advancing my slides. There we go. I noted that we recruited programs for the study using an overarching framework. We didn't recruit programs with any sort of categories or clustering in mind other than they needed to be career pathways programs, but there are some notable patterns. In looking at the data that we collected, we grouped the 9 programs into 5 rough clusters, and they're indicated here. 2 programs are multi-step college-based programs that span basic skills remediation through multiple stackable credentials. 2 programs are short-term, a semester or less, and they focus on accelerated basic skills remediation to prepare students to enter occupational training quickly. 2 are workforce investment board-based programs that use individual training accounts to fund participation in training. 2 are community-based organizations that fund training through an associate's or in some cases a bachelor's level and include intensive supports. And the final program is a single-step workforce training program that explicitly prepares students to enter the workforce, although it also sets them up for future training. So I will discuss each of these clusters briefly. So these are the 2 multi-step programs. Pathways to Healthcare and iBest include multiple pathways that enable students to earn 1 or more stackable credentials. You will hear more about Pathways to Healthcare in a few minutes from Brian Stewart. As all of the programs in this particular program are healthcare related. iBest is a little different in that the programs involved in our study included pathways in different occupations such as healthcare, welding, and office services. Pathways to Healthcare included an accelerated basic skills remediation for those who did not test high enough to enter occupational training directly, which was a subset of participants in the program, whereas iBest targeted students who tested too low to enter college courses, and as such, basic skills remediation was an integral part of that first step on the pathway for all students. And both programs provided academic and non-academic supports, including advising and financial assistance. I'm skipping slides. Okay, short-term college-based programs. This included the Patient Care Pathways program at Madison College and the Workforce Training Academy Connect at Des Moines Area Community College. Both of these were a semester or less. The Patient Care Pathway program had 2 semester-long academies that aimed to help students improve their basic skills concurrently with enrollment in some 4-credit training courses that were needed for their future occupational training. And the goal was to transition into either a 1-year healthcare diploma program or a 2-year healthcare degree program. The Workforce Training Academy Connect program focused first on math and reading skills remediation. This was self-paced, and it was followed by enrollment in an occupational certificate course in a high-growth, high-demand sector at the Partner Workforce Training Academy. Both programs included advising, working with students to identify barriers to success and connecting them to supports, and coordinated academic and non-academic supports. So 2 Workforce Investment Board-based programs, the San Diego Workforce Partnerships Bridge to Employment in the Healthcare Industry program and Workforce Development Council of Seattle-King County's Health Careers for All program provided assistance for training and related supports to enable participants to attend a healthcare training program of their choice at a location of their choice. And you will be hearing more about Health Careers for All in a few minutes from Shauna. In both programs, participants received ITA vouchers to support training at an accredited private school or community college. HCA also purchased classes at local community colleges, which allowed its students to enroll in programs as a cohort. Both programs used community-based navigators to help guide participants in their selection of a training program and a provider. Navigators also identified barriers to program participation and had resources for supports to address those barriers, and both provided job search assistance following the program. Okay, 2 community-based organization programs. Instituto del Progreso Latinos Carreras en Salud program, you'll be hearing more about that shortly, and Valley Initiative for Development and Advancement, which is based on a Project Quest model, supported participants through high-level post-secondary credentials such as licensed practical nurse, associate's degree in nursing. Both had pre-occupational program steps for participants who needed them, whose assessment levels or scores were too low to enter college programs directly. Carreras' on-site lower bridge programs included 3 English as a second language courses, and VITA operated a college prep academy at a partner college. Both programs provided extensive advising to participants and financial support for training. And finally, Europe is a 1-year program which combined 21 weeks of occupational training for careers in growing industries with full-time 6-month internships at major employers. Students received a weekly stipend while in the program. They received advising and connections to needed resources and supports to help them persist. Following the program, they received assistance obtaining employment in the occupational area for which they trained. So with that, I am going to discuss first the implementation findings. The implementation study findings are based on a number of data sources. We conducted 2 rounds of site visits to each program. We had surveys of staff in each program, and we had an 18-month follow-up survey that was administered to study participants at in each program. So in the interest of time, I'll focus primarily on recruitment, innovational instruction practices, advising, and employment connections. Okay, so starting with recruitment. All programs needed to increase their marketing efforts to reach their study participant goal, which was about 1,000 participants for most programs. PACE made funds available to help with evaluation activities, such as hiring staff dedicated to marketing or recruitment. Recruiting such a large sample was challenging for most programs, and not all of them reached their study enrollment target. The programs that did succeed in increasing applications shared some practices, which are listed here. One was proactive and ongoing discussions with key referral partners like TANF offices to describe the study, to be clear about what the program hoped to learn by being in a study, and to address the concerns of partners. And these conversations were ongoing so that new staff were clear about the reason for the program and the evaluation. Testing new recruitment methods. Programs had primarily relied on word of mouth or internal referrals from within their organizations. So programs tried new ways of getting the word out, such as billboards, ads and stories in local weekly newspapers, Michelangelo ads on the ceilings of buses, ads in bus stops. And then programs tracked referral sources. A couple of programs asked everyone who came in the door to apply for the program where they heard about the program, and then they focused their energy and resources on those types of recruitment methods that worked. So those were some examples of helpful recruitment strategies. Okay, so in terms of what we found about the components of career pathway programs, first a few words about innovative instruction. We found that programs had the most flexibility to use innovative instructional practices with their basic skills courses. These courses were the ones that programs generally designed and implemented for their own participants, rather than relying on existing courses at colleges or in the community. As a result, they could build in practices like contextualization of basic skills for a particular occupational area, such as health. They could use active learning techniques like group work, skits, journaling, And they could implement flexible schedules, so having classes in the evenings, having open labs so participants could participate or remediate on their own schedules, and having intensive short-term courses. So examples of this type of innovative instruction include Pathways to Healthcare, the Vita College Prep Academy, the Career ESL Bridges, and the Career Pre-LPN course. So there were fewer examples of innovative instructional practices in occupational training programs. The programs in the study generally used existing college classes that were open to a wider student population than just the program participants. So there was less ability of the programs to implement the types of techniques, adult learning techniques, that might be beneficial to the students, as well as the ability to, they had limited ability to accelerate courses or offer them at non-standard times, such as nights or weekends. The exceptions were iBest and Year Up, both of which incorporated basic skills into their occupational training components, and so they were able to design the occupational training to incorporate and target a specific student population. Okay. All programs incorporated advising to help students persist in their programs. There was a lot of variation, though, in how advising was delivered. For example, whether the same advisor addressed academic and non-academic issues or whether different advisors specialized. The programs had very strong feelings about this. Most programs had a recommended number of advising sessions, such as, once a week, 3 times over the course of a semester-long program, but few mandated advising, and our survey data shows that most students did not participate in the recommended number of sessions. The exceptions were Vita and Year Up. Both required weekly advising, and there were consequences for not attending, including the loss of weekly stipend funds in the case of Year Up, and eventual removal from the program in both cases. Okay, finally, a word about employment connections. Programs noted that aside from specific activities, they addressed employment connections by supporting training in areas where there was strong local demand. And one program actually suggested that was their key employment strategy, was only funding training that was led to an in-demand job. Employment connections generally included workshops on how to look for a job, on resume development. Some programs had dedicated job developers. Programs that trained students in healthcare occupations generally had in-program clinical placements, but only one program, Year Up, had a paid internship as a core program component. Okay, so on to early impacts. Here our findings are based on the 18-month follow-up survey, and in some programs we were also able to access records from the local colleges. For the program in which we estimated impacts on earnings, we used quarterly wage data. So a quick overview of the impact study. This is a high-level overview of the findings for each program. The impacts are based on samples ranging in size from 500 to 2,400 study participants. I'll be presenting early impacts, so that is impacts 18 to 24 months after study participants were randomly assigned. And without getting too much into the weeds, I'm going to present the confirmatory outcome for each program. So we selected one main confirmatory outcome per program. It was based on the program's theory of change and selected to gauge the early success of the program. In 8 programs, this outcome was education related, and 1 it was earnings related. The groups I'm about to present don't necessarily align with the clusters I described earlier, although there's some overlap. So in addition to the confirmatory outcome, we did look at other important outcomes for each program in the educational and career progression areas. I won't cover those today, but they are in the final reports, and they're also in posted executive summaries, and we are creating short briefs that summarize each evaluation. and we can also discuss in the Q&A session if you're interested. So with that said, let's move on to the findings. Okay, for 2 programs, the main outcome was hours of education and training. So looking at this chart, the light blue bar represents the treatment group in each program, and the dark blue bar is the control group. And as you can see for both of these programs, Pathways to Healthcare on the left and Career Sensitive on the right, both had statistically significant impacts on receipt of education and training. In the case of Pathways to Healthcare, it was 63 hours, and for Career, about 46 hours. The 3 stars next to those numbers mean that we were very confident that the differences were due to the program. And if you think about a typical college class lasting or being about 15 hours, these represent impacts of 3 to 4 classes. Okay, for 3 programs, the main outcome was credits earned. So we've got iBest, VITA, and the Patient Care Pathway program. You can see that for 2 of these programs, iBest and VITA, there were statistically significant impacts in credits earned, ranging from 6 credits to 13 credits. 1 program did not have a significant effect on this outcome. One factor not shown here is that the control group enrolled in similar levels of education and training as the treatment group and thus accumulated similar numbers of credits. So that's impacts on credits earned. Then we looked at impacts on credentials received. So for 3 programs, this was the main outcome. These were the short-term training programs, so Workforce Training Academy Connect, Bridge to Healthcare, and Health Careers for All. Here again, 2 programs had impacts. The impact on Bridge to Employment in the healthcare industry was 29 percentage points, or about an 86% increase over the control group. The Workforce Training Academy Connect had an impact of 4 percentage points, which was also significant. Health Careers for All did not have an impact, and as Sienna Rifkin will discuss in a few minutes, a large number of the control group members enrolled in similar training programs, and also due to the timing of the study, PACE did not include a number of the college-based cohorts in the evaluation. Okay, and then the final impact slide is year up. Because this is a workforce training program, we used average quarterly earnings in quarters 6 and 7 following random assignment as the main outcome. As you can see, there was a statistically significant impact on earnings of about $1,900, and the 3 stars again show that we are very confident in that impact. So before I turn the webinar over to Brian, I'll quickly summarize the next steps of the PACE evaluation, and Nicole mentioned some of these. Study participants, depending on the program, may seek employment following their first step, continue on to the next educational step, or do both. So that's why for the next 2 reports for each program, one which will be 36 months post-random assignment and one 72 months post-random assignment, we'll explore both educational and employment outcomes. A number of reports will also include a cost-benefit study. So with that, I will turn the webinar over to Brian Stewart.
Good day, everyone. I think it's evening or afternoon some places and morning where I am. So we're talking a little bit about our Pathways to Healthcare program. To start off with, this is very early Pathways development. We took what we had was around 16 certificates in a variety of healthcare areas, and we brought them into 5 different pathways with career ladders embedded in them. So a significant change in our organizational structure for those. We partnered with our Pima County One-Stop System, which is our WIOA provider, in order to provide additional support for our programs. For people who are unaware, Pima County is the 7th poorest county of our size, as well as the city of Tucson. So we have a very high poverty population. So our percentage to get people in, they had to be at 70% of lower standards of living to get into the program. That was very easy for us to achieve. We are one of the programs that were able to get all of the participants in. We did have to use a lot of marketing and advertising to do that, but we were able to do that because we have a lot of population to qualify for those areas. Some of the other things that we included was we ramped up our advising models. These were things that we were testing out because we were looking at those for the future, so we increased that. We also provided scholarships for a variety of barrier reduction areas, tuition, books, those type of things. And we also included a change in how you look at developmental education, where we were looking at basic skills remediation, and we really targeted two models. One is a more traditional course, where people come sit for a period of time, and the other one was more of an open lab experience where people could come when they were available in order to succeed in those areas. Both were very successful for us. Students completed basic skills faster. They were able to admit into our programming much easier, but we did discover a lot of our findings you'll hear is about transition points. That was one of our major discoveries about how those impact people. Our general findings for the program is mostly we implemented as we originally thought it would happen. We did do some tweaks along the way, mostly in refining of how we structured our advising models, how we handled our basic skills systems, those kind of refinements, but the overall structure was very similar. Ramping up marketing was one of our biggest things we had to do. A lot of the areas that we found is that these students who came through this program, they were more likely to be retained and more likely to persist throughout the program. So we had a better completion rate, persistence, retention in general throughout all of our areas. The people who completed the program, they spent more hours with us. They used more resources, they accessed us better, they stayed connected more likely, and as such, they actually got more credentials. We did have more issues getting them into actual employment, interestingly enough. That will come back to the transition points that we discovered and became a target for future work that we are now doing. Went too far there on my slide. Focusing on partnerships. Partnerships is a big emphasis in our particular program, and I think you'll hear that from my colleagues in some of the other programs. Pima County One Stop was our major partner. They did all of the initial intake for us. They did co-advising with us. There was a lot of transformation that we had to go through in order to work that closely with another governmental agency. Our TANF area was actually, we are a weaker TANF delivery area. And that is because of the way TANF works in Arizona. There's just fewer people on the rolls and fewer access there. But we did have a lot of people receiving food stamps and those kinds of things that we came into our program. They're just not defined as the traditional TANF populations. Our employers, we had a very strong employer relationships. They amplified through this process. We had a lot more internships, a lot more community connection, a lot more employers wanting to help support students who were completing our program and trying to go into employment. That was an interesting sort of discovery. We have heard from other schools and other areas that connecting to employers is sometimes a problem working with low-income populations. We did not have that. But again, it could be because our community is very poverty-ridden, so it's a little more common to have populations with you as an employer. Takeaways. One of the big things that we learned is that working with a governmental organization like a county or a city, that they have not only their culture that works with them, but there's a lot of regulation and governmental things that you have to work through just to get partnerships to work. It's a level beyond what we do with our employers. So that was a great challenge for us, but one we were able to overcome, and that relationship and that intertwining between our county one-stop system and us has amplified, and we are much more connected, and our future grants and things have benefited from that relationship. We had to really change our lens. That was one of the big things we learned looking through the marketing element, is often what we do as educators is or even governmental employees, we look at things from our lens, from our way of looking at things. And the reality is the participants have a whole different lived experience, and we have to understand their lived experience and see through their eyes in order to really guide our structures, and not to assume what they're thinking. We really have to ask them how their experience is, and that we did a lot of that in order to help modify our program slightly to make them more effective towards the completion points. And finally, one of our last takeaways is that one of the elements that we learned is that you have to push harder than you think. In order to really get successes, you may see something working, but the actual significance of that success may not actually occur until you push even farther. So we found things that we were fixing and improving, but we actually went and applied for a later grant, and that has pushed us even farther. So our second generation HPOG was created because we learned that our transition points, so those are points whenever a person is changing from one thing to another, that is more likely to lose the person, whether that's coming into college, whether it's moving into employment. We got really good at getting them into college and staying here, but we were losing them and they were leaving us. So we created a whole new transition point, getting them from college into employment and helping them retain in employment. And that was future stuff that we learned because of participation in this particular study. And lastly, what we have done now, so integrating our results. From the stuff that we have learned through this process and a few other grants that we've worked on, we've radically restructured our organization. The college is now a full guided pathway school. Every single degree and certificate is pathway, similar to what we did in our study here. Everything is stacked, everything is layered. We have now intrusive advising throughout every program. There's program advisors tied to every area. Our tighter relationship with our county has increased the flow of WIOA students and similar populations into the college. We've added new types of courses focusing on student success and on transition points to try to improve their transition into the universities or into employment. And we are increasing our barrier reductions in our schools. So we have programs now that we have built up that provide food pantry services. We partner with our food bank. We've added in clothing supplies. All of these things that were sort of ancillary before, we've made more integral into our mission based upon the findings of this type of study and a few others that we've been participating in. With that, I'm going to be turning it over to one of our colleagues, Sienna, to talk about Healthcare is for All.
Good morning. Hi, this is Sienna Rifkin. I'm with the Workforce Development Council in Seattle. And similar to Brian, we were a participant both in the PACE study and in the National Health Professions Opportunity Grant Initiative. So I'll be talking a little bit this morning about our program that was included in PACE. First, before I get started, just a little bit about who we are. So the WDC of Seattle-King County is the local workforce board for King County in Washington, which is the county that where Seattle is located. We're the largest of 12 local boards in Washington state with nearly a third of the state's workforce. And we really work with job seekers, employers, and educators to meet the needs of our region and manage the federal workforce funding and the services that are delivered through our local one-stop system. So Health Careers for All was the name of the project that we ran that was included in the PACE study. It was a 5-year project launched in 2010, and as mentioned before, a local project of the National HPOG initiative. And similar to all of the projects in PACE, it was a career pathway model. So a little bit about the Health Careers for All and how the project was designed. The primary components were delivery of services around a long-term relationship with a career and education navigator who worked with participants from intake to employment. So a lot of the model was organized around that relationship. Another important component of the program was assessment, both upfront and ongoing throughout the project. The assessment informed an individualized career plan, which was developed early in the process and refined over time. And then, of course, healthcare training was a big, important component of the program. And as Karen mentioned, we supported individuals in training, in some cases through customized training cohorts that were designed in partnership with our local colleges. And many customers, though, participated in training by slotting into existing training in area public colleges or private schools. And then finally, another important component of HCA was employment services and ultimately connecting people to employment in healthcare. So just for context, as Karen mentioned at the beginning, HCA was one of the 3 HPOG projects that was included in PACE, and so as such, we were part of the HPOG National Evaluation, and PACE really was the vehicle for studying impact of our program. We were the last program to join PACE. We joined in 2012, and so for us, that was at the end of the second year of our 5-year project. And so as a result of that, a little over a third of the participants that we had in the HCA program over the 5 years were included in the PACE study. So what did we learn? I think through the experience of implementing HCA and working in this career pathways space, we learned a lot about what we think are the key ingredients in terms of supporting career pathway progression, at least in healthcare, though we think at least some of these ingredients would likely apply to career pathways more generally. One is really clearly engagement and that navigator relationship. For us, navigators were really the linchpin of participant engagement, and we found that engagement was really important in terms of both movement and momentum in career pathways, and that individualized career plan that I mentioned before really was the guidepost with a customer in the lead in developing and refining that. Clearly, assessment is important, you know, in terms of understanding where people are starting, but I think our experience showed us that assessment is important both upfront and ongoing. Robust assessment on the front end, including formal assessment tools, structured interviews, screening checklists, all of those kinds of things really inform the development of a career plan on the front end, and ongoing assessment throughout the time of working with customers really guided the updates and refinements to those plans over time. Another piece that it became clear that it was important both in the beginning but also on an ongoing basis was career exploration, that it seemed to be a really important ingredient to ensure informed planning, and that individuals, you know, really understood what the options in healthcare, which is a fairly complex industry, that they understood where those were and had opportunities to understand what the best fit for them was in terms of thinking about advancing over time. And then another piece that I think has been a great learning space, but also a great struggle, is the prerequisite phase. So I think we learned very, very clearly that you cannot support career pathways in healthcare without addressing the prerequisite phase. It's one that is often overlooked in our career pathway models when we look at graphics that show people how they can pursue different pathways in healthcare. Prereqs is not often addressed, and it's not often addressed in the evaluation frameworks either. And I think we've really discovered that there are many challenges and opportunities that you have to address related to funding those prerequisites, organizing and streamlining that process in terms of the schedule and sequence so that people don't stall out or lose a lot of time during that phase, and then also opportunities to contextualize and to help people understand, you know, kind of how prereqs fit into the larger picture. And somewhat related to that piece, I think we've also recognized the importance of engaging a pretty extensive variety of partners in order to have success in career pathways. So, for example, working with training providers to improve both the predictability of training and different components of the education involved. So, for example, consistency of schedule from quarter to quarter, but also flexibility in the education pathway, so the extent to which you can find smooth and clear reentry points if there are situations where people have to stop out for one reason or another. And then similarly, employer partners, working with employer partners is also very important, and understanding, working together to test strategies and understanding what works and being able to learn from and catalog past efforts as you move forward. And then finally, I think one big key ingredient is really understanding that progression is not always a linear experience, that for individuals it requires a complex array of skills, and including persistence and resilience and flexibility and sometimes creativity, and that all of those things require time, that really more than anything, making progress on a career pathway in healthcare is going to require time, and that the longer the timeline, the more acute the financial and support service need may be, that combining work and more advanced training is particularly complex. And then the last thing that I included on this slide in terms of key ingredients, and in parentheses here, is cohorts. And the reason I mention that is because we've found that using, sort of that explicit partnership between colleges, the workforce board and the workforce system, and employers and other support service providers to develop customized training models and really test strategies, that's been a way to experiment with how to address the opportunities and challenges that I think are captured here in this list of key ingredients. And so I just mentioned cohorts as a place where you can potentially use grant funding to test strategies and understand how to really move these key ingredients forward, and to Brian's point earlier, how you really push on those things that you think may be impactful. So one thing so sort of wanted to talk both about what we think we've learned and then where we've gone from there. So similar to Brian's remarks, we have been fortunate enough here to be able to participate in the second round of the National HPOG initiative. And I included this slide just to share that I think one of the big things that our experience led us to was development of a new career plan template, which we're using now in our second round project, which really was designed by the project staff to try to capture the different steps in the pathway and to try to tie those things to the ultimate goal, and to address that, phenomenon of potentially spending, fairly extensive time and lots of different steps and the potential complexity along the way. And so I just share this as an example of one kind of key takeaway in terms of a programmatic component that we've embedded moving forward. And then the final thing I would share is just that our experience with HCA and with the PACE study has really reinforced for us the complexity of both the career pathway work itself, but also the evaluation efforts that are designed to help understand the impact of that work. And I think for us with HCA, there are some particular research challenges related to describing or interpreting analysis that covers only a portion of project implementation. So we have about 2 years of HCA implementation that's not included in the PACE study. So I think that's a unique challenge perhaps to us here. But I think there are challenges common to career pathways programs more generally that include challenges relating to how do you distill a complex program model. So as Brian described before, and I think it was key in our model as well, there are a lot of different components and a lot of different partners, and so it can be challenging, I think, in career pathways work to describe in a clear way what you actually did so that you can understand through an evaluation framework what works. And I think another really critical piece of that is the timeline piece that I mentioned before. It takes a long time, I think, for people to make progress on a healthcare pathway in particular, and it takes a while before research on findings are available. So you need to really be able to sort of manage the protracted timeline in both cases. And so for us, that's meant, looking at, as Karen mentioned, in the environment that we were in, we found that after about 18 months of being in the program, participants were about as likely as their control group counterparts to have achieved a credential of any kind. But we also found that the participants were significantly more likely than their control group counterparts to participate in healthcare training, specifically, and or report working in healthcare. So I think that opens up a number of questions for us about, does that suggest that the program was effective in keeping people engaged in healthcare as opposed to having them move into some other field that may have felt less challenging or complex? And those are all the things that we don't know yet. So one of the things that we've done here, and I'll just share one last slide, is we've tried to address some of the complexities of putting early findings into context with the development of a companion document that I share here. And it's probably not something that folks can read, but I just share it to say that we have tried to create kind of a companion to the report in our area that helps people here understand, okay, well, what was Health Careers for All? What is the PACE study, and where are we in the timeline, right? So that to really remind people that this is the first of 3 reports, that we have some key takeaways at this early point, but in the longer training timeline, in the first 18 months of being involved in a program, achievement of some sort of credential would be possible. But when you look at how long it takes to move through prerequisite coursework and more advanced healthcare training, there's quite a bit to come. And so we really want to make sure that folks understand the depth of the evaluation investment, and we want to be able to keep people engaged so that the long-term analysis can inform our ongoing and future efforts. And so that was kind of the purpose of this companion, was to kind of help put things in context and hopefully help people intrigued about these additional findings that may come that will tell us a lot more about ultimately how people's earnings and employment and outcomes in healthcare fare as a result of their participation in the HCA program. So those are just sort of some of the things we've learned and where it's taken us here in terms of the HCA project and next steps for us in Seattle, Washington. And now I will go ahead and turn things over to Yvonne and Ian, who will share the particulars of their program.
Great, thanks, Shauna. Good morning, everyone, or good afternoon to our East Coast participants. I'm Yvonne Lau, Dean of Academic Affairs and Career Pathways, and my co-presenter and colleague is Ian Sharping, and we're certainly delighted to be part of this webinar and have this conversation with this distinguished group of experts. So I'm going to share some background and demographics of our PACE study participants and just mention some background characteristics of our profile participants. So basically, Instituto, we were founded in 1977 on the core belief that education is power. We are based on the southwest side of Chicago, where we serve an area where 1 out of 7 Chicago's Latinos live within our 5-mile radius. Trouble here. Okay, yeah. And so, Carreras en Salud, our careers in health pathways, was developed in 2005, and it was developed to address the acute shortage of bilingual and bicultural healthcare professionals in a city where more than 750,000 are Latinos, and where 28% of Latinos over 25 have less than a high school diploma. So the 5 key features of Carreras is that we have a structured healthcare training pathway starting from low skill levels. We provide a contextualized, accelerated basic skills and ESL construction. We have academic advising integrated with comprehensive wraparound services, including on-site daycare. And we offer everything from career coaching to employment services, and finally, that we offer financial assistance. All right. Here. Sorry. Oh, okay. Okay. And in terms of our overall demographics, we have generally in our community 66% are Latinos, 28% fall below the federal poverty level. We have a high number of the population over 25 who, as I mentioned, have less than a high school diploma. 36% of our community are unemployed, and then there's a very high level of low proficiency level. And amongst our clients, the average income is around $17,500. 76% of our clients identify as Latino, Hispanic, and 86% of our clients are female. So for our Carreras participants, we've termed the category of triple non-traditionals. They are largely adult immigrants or English language learners, ELLs. They are likely to be single parents, often earning credentials while supporting their families and having to work at least part-time or full-time. And so they are generally first-generation, high school and college students. And as you can see, the demographics of our Carreras participants mirror these TNTs, where the average age of our participants was 29, 99% of them identified as Latino. Their average income is close to our average Instituto client base, $18,000. At the time of enrollment, 22% of them were unemployed. Close to 92% of them are women, and 45% of them are single parents. So I thought that to bring some life into these demographics, I would share with you the story of Crystal. Crystal, she's 33 now. She had graduated 10 years before she came to Carreras, but she could not continue college because of her undocumented status and because of her inability to receive financial aid. Certainly no one in her family had attended or graduated college, so she lacked the type of social capital to even understand about college admissions or higher education. So after graduating from high school, she spent 3 years working in a factory, but she always had this dream of being a nurse. And so even without documents, she found a job, a dental assistant job, where her bilingual skills would come in handy, and because it was the most similar to a nursing job that she could aspire to without having any documents. So then a critical milestone for her was in 2012, where she applied and received DACA benefits. And then in 2014, she says she was it just happened. She heard about Instituto and the Carreras program after seeing a segment on Spanish news television, Univision in Chicago. And so she came to Instituto, and then she was informed about the study. And then she says that when she was selected for the treatment group, she felt that her life was going to change. She started 3 days after she was enrolled. She came to class every day from 3:30 to 4:30. This is after commuting for 2 hours every day, and she lives in a suburb. And she followed this routine for over a year, gradually increasing her skills high enough to register for college credit courses. She got her BNA certification, and then through the years, she's continued to take college courses so that she was able to fulfill all the prerequisites for our recently launched Instituto College, where she has now been admitted as of August to Instituto College, and we gave her a full tuition scholarship. Certainly, Crystal exemplifies our TNTs. I mean, she was selected for the PACE treatment group, which certainly jump-started her nursing career, But had she not been selected, she would have had to wait 2.5 years to reapply for carreras. I think Crystal and our TNT students exhibit what people like Angela Duckworth have called grit, right? They have overcome many barriers to fulfill their dreams, and certainly we believe that our carrera students and our PACE treatment group members have been the grittiest of them all. So now I'm going to turn over to Ian, who's going to talk more about the study.
Thank you, Dr. Lau. So this first slide has to do with a visual representation of what our career pathways model looks like. As you can see at the bottom, it starts off with sort of your standard ESL adult education classes. Then it progresses up through our contextualized learning through the Health ESL program, and then into pre-BNA, with the students having the option of taking a BNA class leading to their Certified Nurse's Assistant certification. And they can then return and enter into the pre-LPN portion of the career pathway, and ultimately move on to college, getting into an LPN program, or as noted at the top of this chart, into an associate's degree in nursing program, which leads to the RN license. So there are a couple things before I move on from this slide that I did want to mention, and one is that at the time when the PACE study was being conducted, our main funnel was for the students to enter into the LPN programs with the local community colleges, but the industry here in the healthcare industry, and specifically in nursing here in Chicago, has sort of moved away from hiring LPN practitioners, and so we've now modified the bridge a little bit, the pathway, to push the students more towards this registered nurse credential. So I did want to note that, and that speaks for some of the changes in the model. And then I also wanted to note that the pathways that were described earlier today had slightly more breadth, and I believe that our pathway has slightly more depth. So we're focused primarily on nursing in this pathway, but if you, the bottom level there, that ESL component, we do take students in that are at a 4th grade skill level, and then sort of each of these rungs is basically a 2-year skill level improvement. So 4th level, 4th to 6th, and 6th to 8th, 8th to 10th, and then ultimately up to 12th, which would be a college level. The next slide that I have here, really I just wanted to highlight something very similar to what Sienna had mentioned, which is that this is relatively early in an evaluation for a healthcare pathway. This is at the 18-month mark. There are 2 other reporting cycles that will be coming up, and I think it is important to recognize that, because this is relatively early in the process, and some of the findings might be a little early on in the process. Real quickly, I know that the PACE folks had gone over the format, but I did want to give some context. We've got 2 different groups. There were 800 total participants, 400 in the treatment group, 400 in the control group, and both groups were tracked throughout the process. And I think that it's important to note that the 400 control study participants could enroll in other competing programs, so we're very excited and proud about the outcomes that we did achieve, and some of those are here in this slide here. 90% of the treatment group participated in 1 or more courses. The program increased hours of occupational training by approximately 46 hours, educational training hours increased by 178 hours. There was an 18% increase in the number receiving workforce credentials and an 8% increase in those receiving college credentials. And again, you know, it's interesting to note, or important to note, that this is the first in the 3 sessions of reporting, and that could speak to some of those numbers in the 8 and 18% results here at the bottom of the slide. So what's the future for the evaluation process? These are the 4 questions that the next reporting sessions are going to hone in on. Will the impacts of the program on educational attainment remain stable, increase or decrease? Will impacts on educational attainment translate into impacts on employment and earnings? Does the program have other impacts on participants and their families? And then is our program cost effective? Now, I think this is probably the portion that you guys are most interested in, which is, you know, what were some of the challenges that we had? Do we have any areas for improvement? And one of the challenges that we had is recruitment at the lowest skill levels. Generally speaking, the participants have sort of entered in that middle rung. But it is difficult to recruit the students at the low skill levels. It's hard to find them. Some of these groups might be, you know, known as or categorized as sort of an invisible population. So figuring out, you know, what partners can help us to recruit these folks has been an ongoing challenge, but one that we, you know, working on it, we got better sort of as we went. The next challenge is the difficulty in scaling. So we have a fairly robust support services network. So we've got the academic support services and the non-academic support services, and we also use a very proactive advising model. So we'll have our advisors monitor the students on a daily basis and then proactively reach out to them if anything comes up, they miss a class, they miss an assignment. That's a little bit of a different model from the traditional college model, and so that does create some challenges with respect to scaling. Then the contextualization of the curriculum is another thing that we do have some challenges with, and as the healthcare industry locally has shifted more towards the registered nurse as opposed to the LPN, you know, making sure that our curriculum keeps up with those changes in the industry has been a challenge. And then the last thing is, early on in the study, few of the participants made it to the highest level of the pathway. Again, I think that's more because of the timing, but it's something that we have to keep our eyes on. With that, that concludes my portion of the presentation, and now I'm going to be turning it back over to the moderator. Karen?
Julie?
Over Julie?
Yes, sorry. This is Julie Strawn with Apt Associates. I'll be moderating the question and answer portion. We're going to start with some questions that came in while the panelists were speaking, and several were questions that wanted us to clarify what we meant by certain terms. So starting with Shauna, Shauna, there was a question about what you meant by the prerequisite phase. So, and in particular, is this the same or different from basic skills remediation? And in addition to clarifying what the prerequisite phase means, they wanted to know if those prerequisite students were a part of the study.
That's a great question. Thank you. Yeah, so roughly speaking, in the healthcare context of a healthcare career pathway, when we talk about prerequisite coursework, it's typically college-level courses that are required to be completed in order to be eligible to apply to more advanced healthcare training programs. So they're often college-level English and math, a variety of science classes. I noticed some of them were on the Ian's last couple of slides, things like biology, anatomy and physiology, in some cases chemistry. So typically prerequisites, while they're distinct from basic skills in the sense that basic skills and ESL and those kinds of coursework are typically pre-college level. Prerequisite coursework is typically college level coursework. And in the case of nursing, at least in our area, can take students anywhere from a year to 3 years to complete and earn the college credits that they need in order to be able to apply to more advanced programs like the associate's degree in nursing, for example.
Mm-hmm. Thanks, and that really helps highlight why 18 months in terms of these initial PACE research results isn't very long in terms of people moving along the pathway, and we'll learn a lot more at 3 years and 6 years in the next 2 follow-up studies about how people are progressing on that journey. Karen, a question for you that came in is, can you clarify what you mean by bridges? What do those look like? Is it just another term for transition from adult ed to post-secondary education, or what does it mean?
So I think I used bridges in a few different contexts. One was specific to Instituto, or the Carreras program, and Ian and Yvonne could certainly talk more to that. In that context, the bridges meant the actual courses, so different levels of ESL. There were lower bridges that were provided on site at Instituto. Upper bridges were the courses that were provided through community colleges. But aside from Instituto, when I mentioned bridges, it was to basically the developmental education, the basic skills that led to the higher, the occupational training. So a quick bridge into occupational training in the case of like the College Prep Academy or the college readiness at Pathways to Healthcare. So yeah, that was like a quick transition into an occupational training program.
Thanks. So Yvonne and Ian, there are a few questions for you that's maybe easiest to answer all at once. So one is, what is basic nursing assistant, the class and the certification? So is that the same as certified nursing assistant, for example, or is that something different? And then participants would also like to know more about the pre-LPN course.
Sure. So, yes, the BNA and CNA, Basic Nursing Assistant and Certified Nurses Assistant, are really the same thing. We wanted to separate the nomenclature so that the students know or the employer knows that they're not CNAs until they actually pass the certification exam. So you could have received the basic nursing assistant training, but not be certified until you take the test. So we wanted to make sure that we distinguish between the two, but yes, they're the same thing. And then the other question was around, I'm sorry, could you repeat that one more time?
About the LPN course, could you tell us a little bit more about it? The pre-LPN course. Yeah.
I got you. The pre-LPN course. Yeah, so we found that our students are not quite ready many times to enter into those prerequisite college level courses that we just talked about. So the math courses, the English, the science courses are Many of those have labs. They're pretty rigorous. They're reading intense types of courses, and some of our students have struggled with those or being eligible to get into that college level course right away. So we offer this we termed it pre-LPN, and basically it's to help students with math skills and reading, comprehension, and English level courses. So they're similar to a remedial type of course, but it's contextualized. So we'll be still talking about those within the healthcare and nursing context.
Okay, thank you. Karen, there are a couple questions that came in around financial support. So one question was specifically for iBest, whether iBest provides financial aid itself, or if not, what other kinds of aid do students in iBest receive. And then there was a more general question about across all of these PACE programs, were people receiving stipends while in education and training, and if not, basically how did they afford to participate?
Okay, thanks, Julie. So my lens for iBest is iBest as it was constituted in the study. So we had 3 colleges that participated in iBest in the PACE evaluation, and I mentioned early on that we received some foundation funding for PACE that the purpose was to bolster different components of the programs that were participating in PACE. So iBest generally helps students apply for Pell Grants and apply for Washington State has opportunity grants. And for the programs that were in PACE, the 3 colleges the advisor would help students do that, but then there was what we called fill the gap funding that was available through this foundation grant that we received from the Open Society Foundations. So for that, for the 3 colleges only in PACE, we did have that direct financial assistance, which is a little bit different than the iBest model at the colleges that were not part of the study.
And if you have an opportunity to look at the iBest impact report, you'll see that in the 3 colleges in our study, the share of participants receiving need-based financial aid ranged from 21% in one college to a high of 54% in another. And on average, across all of the Washington colleges, community and technical colleges, iBest students, 38% of them receive some form of financial need-based aid. Karen, can you speak to the question of whether people received stipends in any of the PACE programs to help them not have to work while in school or work as much?
So the only program that provided an actual stipend was Year Up, and it was a full-time, very rigorous program. And there were many purposes to the stipend, but one was to eliminate the need to have to work outside of the program. And the programs in PACE varied greatly in terms of whether they were full-time, part-time, and I mentioned the length of the program. There was one program that was full-time, required full-time college enrollment, and that was VITA. And in that program, as part of the intake, there was a lot of advising around supports that might be needed, kind of going over budgets and making sure that the participant could engage in training given household circumstances and finances. Other programs, I think there were a combination of people were working while they were in school. A number of the programs had schedules such that they had evening classes or were very short-term programs that lasted, 8 to 12 weeks, and so people could go in and out of the program relatively quickly. So and it's something that we will continue to look at as part of the next PACE reports, is the degree to which people are kind of combining work and education or toggling back and forth between the two. But the different programs took a variety of approaches to that.
Mm-hmm. So a question for the PACE programs on the line is, what on average was the cohort size for your programs? And did you find it challenging to recruit enough people to fill a cohort?
This is Shauna at the WDC, and I think where we did invest in customized training cohorts that were designed so that they could be filled exclusively with our participants, those ranged in size from about 16 to 32. And I think the answer is yes and no. It depended on the type of cohort. So we did some customized cohorts that were more along the lines of the bridge programs that Karen described earlier. So they were more on-ramps to occupational training. So they might be programs that had some element of career exploration and some foundational academic skill development that was contextualized to healthcare, designed to bridge to a healthcare occupational training program. But then we also did a small number of specialized bridge programs that were actually taking the existing healthcare occupational training program and changing the delivery methods slightly, so not the curriculum so much as the delivery. And those were, we did those in a few different areas, including nursing. The things like nursing are typically not hard to fill or to get to your numbers. The bridge cohorts were quite a bit harder because, as anyone who works in a college environment knows, that enrollment thresholds are really important in terms of being able to have a successful class move forward. And the more specialized some of these programs were, they were sometimes challenging to get the right number of people who were kind of already at the same time in the same place, who could, do the same schedule. So we had sometimes some challenges with enrollment and other times not so much.
Mm-hmm. Okay. We have a question about recruitment. So the question is, other than TANF offices, billboards, ads in stores, and buses, were there any other means you all used to recruit for your programs?
So this is Yvonne. I would say that, certainly for our audience, we had to go through the whole Spanish language community networks, and a lot of our recruitment efforts, I think, more recently have been also successful on by posting announcement on Facebook, and but definitely we had to use Spanish language vehicles, and I would not think that traditional ad vehicles or putting posters on buses, I don't think would be as effective for us.
Yeah, this is Shauna in Seattle, King County. Similarly, I think we've done some toying with things like bus ads in the past, but I think what's been much more effective for us has been the using the team of staff that actually deliver the services to develop a pretty extensive array of networks and relationships through the community-based organizations in our communities. So that includes community-based social service agencies, that food banks and libraries, community centers, those kinds of things, but also cultural organizations and language-based groups, public areas like laundromats. I think we've really tried to get out into the community and use, in addition to TANF offices and our workforce offices and college campuses, to really get out to those community-based locations to spread awareness, and which actually also develops a greater and much more extensive word-of-mouth network, which is still, I think, one of the most powerful recruitment avenues.
Yeah, and just to add to what Shauna said, certainly I think I agree, yes, word of mouth is the most powerful, and I think because of how CODETA started back in 2005, you know, we actually have multi-generational groups of users. You know, in our nursing class, for example, we now have a number of students whose parents, you know, first came to Instituto using our ESL and citizenship services. And so, you know, most of our clients, I think that, although I wasn't here when the PACE study was implemented, it's really through word of mouth and just by, you know, as Shauna said, churches, community-based organizations, and, you know, their friends, their family.
Mm-hmm. Okay, thank you. Is there any one group of support services outside of financial aid that your programs have found to be the most important when it comes to supporting student success?
Yeah, this is Brian. I'll say for our students is emergency support. We have a very robust, something happens, you know, a medical event or your lights get turned off or any type of emergency. Those kind of supports and being available were probably the most instrumental in keeping students in the classroom because they had something, they didn't have to worry about, something was taken care of for them, so.
And this is Yvonne. I also feel that, again, for us, given the number of single parents and, you know, people who are maintaining their work schedule and their family schedule, that on-site childcare, certainly, you know, our motto at Instituto has been that we don't just enroll the student, we enroll the whole family. And the more we can do to help our students stay focused and be supported, not only in their curricular goals, but also, you know, in their just maintaining their daily lives and trying to find this way to balance their work life, their part-time jobs, their full-time jobs, as well as their course of study. We have to support all their needs, which is why we think that our wraparound services are key elements of our success.
This is Sean. I would echo both of what Brian said and what Yvonne said, and I would just say that I think one of the key ingredients that, you know, having that, whether it's in our case what we call a navigator or an advisor or somebody who has a longer-term relationship with people as they do make transitions, is really helping support someone in navigating the you know, number of channels they have to go through to access resources that will be critical to success. So I think one really important element of success is making sure that people have the right combination and kind of complement of support resources in place so that they can be successful. And then to Brian's point, I think one of the things that's been powerful in the programs that are included in the study is that most of us, I think, did have access to some source of funding that could fill the gaps or address emergencies, so that people, when they did experience those kinds of situations that could otherwise knock them off track, that we were able to support folks in you know, kind of overcoming some of those hurdles.
A related question that came in is, so given all those kinds of supports that you have found can really help students succeed, is it possible to implement career pathways approaches without restructuring college courses, curriculum, program structures? Are there examples of simply working basically with existing curriculum and course structures just by adding these kinds of supports and having it be successful? And Karen, you know, that's partly, I think, a question about to what extent the PACE programs restructure the college courses and curriculum. And I think you said at the start that, at the start of the webinar, that they were able to do that on the basic skills front, and it was less common, though, on the occupational training front.
So this is Brian. I'll say yes and no. So it's going to depend upon what your objective is. For us at PIMO, our objective is to try and get people to transition as quickly as possible to their overall goal. A lot of our historical college structures are based upon a 4-year academic philosophy and pedagogy. We use ideas that have existed for 100 years that don't always apply necessarily to the goals of our students. That doesn't mean they're ineffective, and that doesn't mean that you can't put extra services around that help them be more successful, absolutely. But if your goal is to really shape and get people to another level faster, you have to actually change what you're doing. And it doesn't mean completely restructuring your curriculum or your programming. It does mean thinking strategically about what and asking questions about why do you have courses aligned like they do? Do students really need a whole year of exploration in order to figure out what they want? Are there ways to work with your high schools and other community organizations to get them to explore faster before they get into you? So that if you ask questions differently, it will prompt you to change things strategically for your area. That's why we've gone through all of this work, is we really wanted to make sure we had the data before we began to change things. We jumped into being a pathway schools because the data showed us that that is really what our community needs. We still have students who are more exploratory, but the majority of our occupational CTE-related programming are really pathways now, and really try to get students out in 2 years, and really try to get them transferring and those type of elements. And we've added extra sources to help them be successful in that, where it's most strategic and beneficial for our students, not based upon what we think will be beneficial to them.
Thanks, Brian. Did anyone else want to? Oh, okay, go ahead.
Yeah, Yvonne. So yeah, I would say that there's no one pat answer. I mean, to us, we feel that you have to know your clients, right? And as a nonprofit, we have perhaps the luxury of meeting our clients where they're at, right? And so for us, we could not have a successful career pathway program, or now even a institutional college ADN program, without understanding that our students, they have multiple needs. They come with us with a lot of grit, but they have also remaining barriers that they have to constantly juggle to maintain their daily lives and to take care of their families. So we have to, in our institutional college, for example, we're offering evening classes because despite providing full tuition scholarships for our students, thanks to JP Morgan Chase, we recognize that they have to maintain their households, and so they have to often still have part-time jobs. How can we not understand what their daily lives are like, right? So I think that the most important thing to do, if you want a successful program, if you want to have retention of your clients and students, is that you have to know where they're at, and you have to meet their needs and do everything possible to restructure whatever curricular or other types of support activities that will meet their needs and help them achieve their academic and their lifestyle goals.
Mm-hmm. So we're a little past the end of the webinar. We do have several other questions pending. I think what I would like to do is continue on for a few more minutes. We may be cut off by WebEx at some point, but we'll continue on for a few more minutes, see if we can just address those remaining questions. If you need to hop off, we will be posting the webinar slides and the recording. We will try to also respond to the questions we don't get to right now via email as well, and really appreciate everyone joining us. So the next question is, for those of the PACE programs on the line whose pathways include both non-credit and credit-bearing classes, how did you get the certificate non-credit programs and the credit programs to work with each other, and were you able to get the more academic programs to acknowledge training classes as college credit, things like that?
So this is Shauna, and I would say that somewhat complicated answer in the sense that there are a lot of different ways, but one vehicle that we used for doing that was through purchasing some customized cohorts where we were able, because of the fact that we were funding the costs associated with developing something, we, I think, had some greater flexibility in bringing more people to the table. So individuals across different departments or disciplines within a college, for example, and having the kind of credit-bearing, non-credit-bearing sides of the house together to potentially engage in some conversations about connecting those dots more effectively. And so I think, to me, in a lot of ways, the benefit of some of those customized cohorts was not just the cohorts themselves, but the opportunities that came about through developing them to develop and build relationships and to help stimulate learning. So that, I think, is one way that we have done that. I think we've also tried as much as we can to sort of disseminate the things that we learn and to engage our partners through, project-based steering committees and through, in some cases, convening partners to have discussions about, okay, this is where we are starting to understand that we're having barriers. So I think there's a lot of different ways that projects have done that.
This is Brian. Honestly, during PACE, most of what we used were things that were already connected. So we already had credentialing allowance for nursing assistants, moving into LPNs and LPNs into RNs. So we already had some things preset. Since PACE, however, we have a very robust prior learning assessment that recognizes and has a whole system that allows us to validate non-credit or industry-based credentials moving into our institution. So it really started the conversation, and since then we've done more.
Great, thanks. Another question we have is whether any of your programs have been working with local high schools, both to help change or frame high school curricula and programs like internships to help position students for these kinds of career tracks in post-secondary.
So yeah, this is Yvonne. So we have worked with Chicago Public Schools. In fact, this past year we offered a pilot program with Gage Park High School. It was to offer a pre-BNA class at their high school, and those who successfully completed that course and passed it were enrolled in our BNA program for the summer. And out of that class, one of the high school students was the salutatorian of our summer BNA program, so that was one. And also at Instituto, we are fortunate to have two high schools attached to Instituto. One is the Instituto Health Science Career Academy, and we have also offered our pre-BNA classes as well as a BNA class for the high school. And of course, we have tried to really strengthen the pipeline from high school to now our college. So that is something that we're very, very aware of, the need to provide early exposure to, especially, our population, vast number of which are, represent minority groups, and they are, they lack the type of social capital that really, helps them understand different career pathways in nursing and in healthcare. And so early exposure is something that we definitely believe in, and I think we have sparked interest among several CPS Chicago Public School high schools in the community to develop their own curriculum.
Okay, thank you. And then I don't know. Well, let's skip the question about funding. We'll get back to you on that later because I'm not sure if Nicole is still on the line. There's a quick question about, and maybe Karen, you can best answer this, as to what extent the other programs in PACE served ELL students. So outside of Instituto, what did that look like? Were they serving mostly native speakers or?
Oh, hi. So IBEST did recruit ESL students on campuses. So those would be students who, as part of the basic skills work, were working on their language skills as well. Other programs that were in areas that that served a large number of Latino participants tended to rely on the college courses at their local colleges, and so there wasn't so much an ELL student once in the program. The remediation would have to occur, I think, or the language skills would have to occur before going into the program.
And then VITA also served primarily Hispanic students, is that right?
Yeah, VITA served a large number of Hispanic students, and as did Pathways to Healthcare, but because VITA required participants be at least at the 10th grade level to enter the college prep academy or college level to go directly into occupational training, they required that students be able to take the classes at the colleges. So there wasn't a specific ELL component to that program. And I don't know if Brian wants to weigh in on participants who needed the language skills prior to enrolling, because Tucson is, it's a heavily Latino part of the state.
And we have, so the college overall is over 60% Hispanic, and this population was actually a little higher than that. We had a cutoff. If they were less than 3rd grade, we referred them to community partners before they even tried to apply into the programming that worked at that level. In our basic skills, there was English language embedded in that process. Tucson's a little unique, and although we're predominantly Hispanic, we have a lot of our students are bilingual. So we don't have as much ESL population as it's more just trying to elevate language skills in general, in the broad sense of it.
And I would just add, this is Shauna in Seattle, that both Seattle and King County, as well as San Diego County, are areas with a fairly heavy proportion of immigrant and refugee communities. And so the population served in our program here and the San Diego program were very diverse, with many languages spoken, and included native English language speakers and people at varying levels of English second language skills.
Okay, thank you. So we're going to take one last question, and then I think we will have to wrap this up. So the last question is, can you describe your employer partnerships and how they help students get a job once the training is completed?
I think all three of us are probably a little different because we're different types of organizations and sort of live in different spaces, but I would say that there's, I think Brian described some of the clinical relationships in terms of that clinical-based education component that I think is a really important connection to employers. Many students do, when they achieve occupational certificates, many of them do find employment through those clinical opportunities. In the workforce, for us as a workforce development council and overseers of the local one-stop system, we really try to leverage the employer relationships that are developed through our business services in that arena, as well as those relationships that are developed through the college process, to ensure that we're very well aware of where the opportunities are and that students have access to a wide variety of openings.
Yeah, so this is Yvonne. And similar to what Shauna said, yes, of course we have clinical partners for many of our different programs, including our BNA program, and so certain hospitals have been designated as our major partners, and some of them, of course, are very happy to recruit our students. Some of them actually have a higher relationship where they have provided some seed money for our BNA students as well. So they have, I guess, not only are they interested in hiring our graduates, but they certainly provide things like, helping our students go through mock interviews and really preparing them for the nursing profession. And I think that, of course, we also have other partners that are just, very eager to get our bilingual nursing graduates. So it's, I don't think, I think that Instituto is fortunate to have a lot of community partners and industry partners as well.
Yeah, this is Brian. Certainly our internships and clinical relationships are our strongest suit, or were our strongest suit, and students get employment through those avenues. It's our best way of helping students achieve employment. However, we have learned from Shauna and Yvonne and other of our colleagues, and I can't reveal everything, but watch HPOG 2. That's all about transitioning to employment for us, and we have some interesting results about what a college can do in that area. There's more we can do.
So Brian's talking about there's a separate evaluation of the second round of health profession opportunity grants that's going on. Brian's college is part of that, and so we'll be able to share those results sometime in the future. Thank you all for joining us, and appreciate those participants in particular who stuck with us through an extra 15 minutes of Q&A. And a big thank you to all of our presenters. We really appreciate you taking time to share your experiences with us today. Bye-bye.
Thank you.
Bye.